This is the Current Events Project. My current topic is reporting a colleague's HIPAA violations. Firstly, what is HIPAA? HIPAA stands for the Health Insurance Portability and Accountability Act. HIPAA covers the health plans, healthcare providers, and healthcare clearinghouses. Health plans refers to different insurance plans such as health or dental or vision, which are the plans that provide coverage for patients. Healthcare providers are providers such as insurance companies as well as institutions like hospitals, as well as individuals like doctors or dentists, the ones who actually actively provide the care in person. Then there's also the protected information. HIPAA specifically protects patients' medical records and something called personal health information, which is shortened to PHI, as well as payment information from unauthorized access. HIPAA also does not protect de-individualized health information, where the health information cannot be used to identify a person or important sensitive information regarding that specific person. According to HIPAA, the covered entities in these rules must receive express permission by the patient in order to provide or access this information, or should be given, or the covered party should be requested to give the information over by the HHS for an investigation, like an audit, in order to ensure the compliance of that company. The ethical responsibility of reporting HIPAA violations. The importance of reporting these HIPAA violations is that, firstly and most importantly, it protects the privacy of the patient. The HIPAA exists first and foremost so that the personally identifiable information of a patient, as well as the sensitive health information, can remain hidden unless it's for people that specifically need it in order to conduct specific jobs. Furthermore, the reporting of HIPAA violations also prevents potential harm from misusing access to this sensitive information, like using it for personal gain or for personal profit. It also protects the trustworthiness of healthcare providers, as patient information can remain more secure, as it is only ever revealed or accessed in very specific situations where it is necessary. Finally, also, reporting such violations ensures the accountability of healthcare professionals and prevents healthcare professionals from abusing this access to the sensitive information. Finally, reporting HIPAA violations ensures compliance with the law and can prevent that health institution from receiving legal penalties from the unlawful dissemination or access of this information. The societal issues regarding HIPAA violations. The issues with HIPAA violations is that HIPAA itself is supposed to protect patients from having their personally really protected health information from being misused for personal gain. Furthermore, HIPAA compliance also ensures the security of patient information by limiting its access only for necessary viewers, as described in Alder 2025. Unauthorized access and disclosure of PHI has the risk of leading to potential fraud or financial harm to patients, as this information can lead to financial fraud or identity fraud, as the personal information can be used to pretend to be that person. Finally, violations in HIPAA violations, if not properly addressed, can lead to the erosion of public trust in certain healthcare providers. The scenario and ethical dilemma. The scenario of this topic is that Dr. Bob is a cardiologist whose practice needs more patients to give him the income level he desires. Dr. Bob uses his access to the hospital records to look for potential patients and then visits them. even though they had not requested a consultation with him, and he even orders tests on these potential patients to be performed. Dr. Sam, a friend of Dr. Bob and head of the ethics committee, has found out that Dr. Bob is doing what is considered a major HIPAA violation. Dr. Sam is seriously considering reporting Dr. Bob to the rest of the ethics community, even though he and Dr. Bob are friends, and the violation is likely to result in severe consequences for Dr. Bob. The dilemma: is it ethical for Dr. Sam to reveal to the entire ethics committee what Dr. Bob has been doing? The intended and unintended consequences of this action. The intended consequences are to ensure the legal compliance by properly reporting any sort of HIPAA violations and allowing the law and legal penalties that are necessary to take effect. It also protects the patients from further potential harm, as Dr. Bob's actions can lead to potential financial harm or even physical harm, as if the patient's autonomy is removed in order for Dr. Bob to do these actions, it can lead to the patients having to pay for financial treatments that they did not initially want, or it could also lead to the physical risks of taking tests that aren't necessary or that aren't specifically requested by the patient, as even physical tests have the potential to cause further harm. Furthermore, it allows this specific information breach to be properly addressed and prevented in the future by ensuring that such information can only be accessed when it is guaranteed that the patients had given their permission. Finally, it allows for the proper punishment from the offending doctor to occur so that the Dr. Bob in this situation, cannot continue further breaches in privacy for these patients. The unintended consequences. Firstly, it has the potential of damaging or straining professional relationships between Dr. Sam and Dr. Bob, as well as the other doctors, as a result of this report. Furthermore, there's the risk of the administrative burden caused by this investigation into the HIPAA violation, which would divert resources away from the typical hospital's activities and towards properly investigating and auditing any other potential HIPAA violations. Finally, this would more than likely lead to a short-term damage in the reputation of the institution where this HIPAA violation occurred, as people would see such a misuse of the personal information and would likely be worried about potential breaches in privacy in the future. The future aspects. Firstly, as technology continues to develop, there is the increased risk of data breaches through cyber attacks. The biggest example right now is the Change Healthcare cyber attack, which occurred on February 21st, 2024. On that day, a Russian group called ALPHV Black Cat stole, alongside the personally identifiable information stolen by Black Cat, the entire Change Healthcare was underwent a significant cyber attack that disrupted its daily activities, as well as stole away the personal information for 192.7 million patients, and then demanded a ransom of $22 million in order to delete that stolen information. This massive data breach is on a far greater scale than even this possible scenario and other scenarios where individual actors could utilize this information for their personal gain. As such, cyber attacks are becoming a new important aspect that HIPAA needs to actively target and needs to dedicate security rules towards in order to ensure that such harm on such a large scale can't occur again. As such, it is likely that HIPAA will take an increased importance in the future in order to keep the personal information for these patients secure from other cyber attacks. These are the references.